Hey everyone, you're on your way to becoming a certified nurse assistant, or maybe you're already out there changing lives. That's amazing. We talk a lot about skills like taking vital signs, assisting with daily living, making a perfect bed corner, which, let's be real, is an art form. But today we're diving into two things that are the absolute foundation of everything you do: ethics and confidentiality. Think of these as your CNA superpowers. They aren't just a bunch of boring rules you have to memorize for a test. They are the very heart of the trust you build with your patients every single day. Without them, the whole system of care just falls apart. Building that trust is your #1 mission. Your patients are in a vulnerable position. They are relying on you not just for physical help, but for kindness, respect, and safety. All right, let's tackle this word: ethics. It sounds so official and complicated, right? But it's actually super simple. Think of ethics as your moral compass for work. It's the set of guiding principles that helps you figure out the right thing to do, especially when no one is watching. In healthcare, ethics is all about making choices that prioritize your patient's well-being, dignity, rights. It's not just about following the rules written in a handbook. It's about the why behind those rules. It's about treating every single patient with the same level of respect and compassion you would want for your own family. For a CNA, ethics show up in everything you do. It's in the way you speak to a resident who is confused, offering them patience instead of frustration. It's in taking the extra minute to make sure a patient is comfortable before you leave their room. It's about being honest if you make a mistake, like accidentally spilling water and reporting it properly. Okay, let's get practical. Knowing the theory is great, but you need to know what to do on your shift. So here are the absolute DOs of being an ethical CNA. Do versus don't. Show do column and don't column. First and foremost, do always treat every patient with respect and dignity. This means using their preferred name, knocking before you enter their room, and explaining what you are about to do before you do it. Do be a great team player. Communicate clearly with the nurses and other CNAs, offer to help when you can, and maintain a positive attitude. Another major DO is to always maintain professional boundaries. It's wonderful to be friendly and build a rapport with your patients, but they are not your personal friends. Now for the other side of the coin, the don'ts. First, don't ever neglect a patient. Don't ever engage in any form of abuse. Always be gentle and calm. Now for our final topic, which is a huge part of ethics: confidentiality. Basically, what happens in the hospital stays in the hospital. Patient information is private. Their name, diagnosis, test results, the fact they are in the facility, it's all protected information. This isn't just a nice idea, it's the law. HIPAA, Health Insurance Portability and Accountability Act. Breaking this rule can mean losing your job, facing massive fines, even legal action. So think of yourself as a guardian of secrets. Why is this so important? It all comes back to trust. Imagine going to the doctor for a sensitive issue and hearing neighbors talk about it. Honoring that trust creates a safe space for honesty, leading to better care. Right way. I'm sorry, but to protect privacy, I can't discuss specific individuals. Don't post about your workday on social media, even without names. You are truly making a difference, one ethical decision at a time.